Alterations in immunity and hematology, immune disorders. An allergic disorder is characterized by a hyperimmune response to a weak antigen that usually are quite harmless. Antigens cause an allergic response, and we call these allergens, and somehow they gain entry from the environment. An allergic reaction might be sudden or gradual, and it may gradually disappear and/or be replaced by a similar sensitivity to a different substance. It's characterized by the manner in which the allergen gains entry to the body and the intensity of the response. Realize that allergies can occur at any age. So affected organs usually are going to involve the skin, respiratory system, GI tract, blood, and vascular systems. Allergen types are going to include ingestants. These will be food and drugs, inhalants, such as house dust and mites, and contactants, such as latex, and injectants, such as drugs or bee venom. Different examples will include allergic rhinitis, contact dermatitis, food allergies, urticaria, and angioedema. So the first exposure to an allergen is not going to produce symptoms, but it does start a sensitization process. Sensitization process is where the cellular and chemical events occur after a second or subsequent exposure to an allergen. Once sensitization occurs, one of four types of hypersensitivity responses can occur, and they can be immediate or delayed. So we have type 1, 2, 3, and 4. An immediate hypersensitivity response is due to antibodies that interact with allergens, and it occurs rapidly. Type 1 is the most severe, and we see that with atopic or anaphylactic reactions, and it's mediated by the immunoglobulin E antibodies. It is the most severe type of allergy. Type 2 is cytotoxic, and it's mediated by the immunoglobulin M or G antibodies. Type 3 is the immune complex mediated by the IgG antibodies. And type 1 and 2 occur within minutes, while type 3 responses reach a peak within 6 hours after exposure to an allergen. Anaphylaxis is that rapid and profound type 1 hypersensitivity response, where we see a massive release of histamine that causes vasodilation, and we see an increased capillary permeability. Symptoms would include an angioneurotic edema, which is the acute swelling of the face, neck, lips, larynx, hands, feet, genitals, internal organs. We may also see hypotension and bronchoconstriction. Realize that anaphylaxis, if it's left untreated, can be fatal. With the delayed hypersensitivity response, which is type 4, the antigens are initially phagocytized by macrophages. We see sensitized T cells then produce cytokines which cause that inflammatory reaction. And these can develop over several hours or days. A suppression of the allergic response may be done by a release of eosinophil chemotactic factor, a chemical mediator from the mast cells, and helps suppress the inflammation. It can also be done by chemotaxis, which is the process of attracting migratory cells to a particular area of the body. Epinephrine, which interferes with the release of vasoactive chemicals from the mast cells, and corticosteroids, which are considered to be anti-inflammatory hormones that block the synthesis of prostaglandins and leukotrienes. Clients who have an allergic response may experience shock, laryngeal edema, wheezing, stridor, tachycardia, generalized itching, hypotension, bronchospasm, and the angioneurotic edema. Now, less severe localized hypersensitivity reactions may include watery eyes, that increased nasal and bronchial secretions, sneezing, vomiting, diarrhea, hives, itching, localized redness, and dark areas under the eyes. With ingested food allergens, we may see abdominal cramping, vomiting, and diarrhea. With the injectants, or the venom, this will produce a systemic and potentially fatal effect, shock, and airway obstruction. Complications of allergies include clients that have inhalant allergies or allergic rhinitis. They can develop nasal polyps from chronic inflammation. These are going to be people like with hay fever. They're going to be prone to sinus infections, secondary pulmonary infections, and asthma. We treat allergies by relieving those allergic symptoms, and that will depend on the type of allergy it is. So it may include drug therapy or a desensitization therapy, where we inject a weekly or twice weekly injection of the dilute allergen with increasing concentrations. And this will help desensitize the client to that particular allergen. And they can also accomplish that through a sublingual swallow immunotherapy. Nurses need to make sure if there's swelling of the hands to remove rings from swollen fingers. And there is a great demonstration in your book on how to do that without cutting the ring. We need to schedule the client for diagnostic skin testing, teach them to avoid taking any prescribed or over-the-counter antihistamines or cold preparations for at least 2 to 3 days before the skin test. Instruct them on the use of the EpiPen. Clients need to know how to use an EpiPen. We also need to teach them how to administer serial doses or how to monitor following desensitization injections or the allergy shots. And we need to provide client and family teaching to avoid or reduce any exposure symptoms. So as the nurse is assessing the client, which of the following is a symptom that the client with anaphylaxis may be experiencing? That will be wheezing. A nurse would evaluate that the client understand what triggers allergic rhinitis by which of the following client responses? Airborne pollens and molds. Autoimmune disorders involve killer T cells and autoantibodies that attack or destroy the natural cells that actually belong to the client. Autoantibodies are antibodies that fight against those self-antigens, and they're considered to be immunoglobulins. They're going to target the histocompatible cells, or cells whose antigens match the individual's own genetic code. In other words, in autoimmune disorders, the client's cells, their immune response is going to actually fight their own cells. Diseases that are considered to be autoimmune when they're characterized by unrelenting progressive tissue damage without any verifiable etiology. Examples will include hemolytic anemia, multiple sclerosis, myasthenia gravis, ulcerative colitis, and these diseases are discussed in other modules in this course. Alloimmunity will describe an immune response against transplanted organs or tissues that carry non-self antigens. So there's several causes, several theories on the causes of how autoimmunity comes about. A couple of those include the tissue injury theory, which can be triggered by infection, trauma, or introduction of a drug that integrates itself into the membranes of the host's cells, such as streptococcal infections or rheumatic heart disease. Another theory is the genetic instruction theory, where genetically predisposed to autoimmune disorders, such as a sequestered antigen theory. If you look in your book, there are several theories listed, but we're not getting too in-depth into those theories. This is just kind of a for your information. These clients may have symptoms that depend on the tissues and organs that are affected. These symptoms are going to be characteristic of an acute inflammatory response. They may show a low-grade fever, malaise, fatigue, or weight loss. And inflammatory symptoms are going to develop as antibodies attack normal cell tissue that they mistakenly identify as not belonging to themselves. Exacerbations will alternate with periods of remission, and the duration of these periods is completely unpredictable. We diagnose with an ESR, or erythrocyte sedimentation rate, which would be elevated in the cases of inflammation, an anti-streptolysin O titer, an anti-nuclear antibody titer, and a rheumatoid factor may also be done. These disorders are rarely going to be cured, but we can administer some drugs to help minimize the effects or symptoms, and that would be anti-inflammatory agents, immunosuppressive agents, cytotoxic agents, and corticosteroids. Nurses should obtain a good family history, vital signs, and examine the client for signs of localized inflammation and compromised body functions, in addition to assessing their level of energy and reviewing lab test findings. Chronic fatigue syndrome is profound fatigue that has no identifiable cause. This fatigue is going to worsen with physical activity, and it does not improve with rest. There hasn't really been a cause identified, although it has been linked to a potential deficiency in adenosine triphosphate, viral assaults, immune system dysregulation, where the system is going to be activated for an extended period of time, or a combination of genetics, viral or bacterial infections, and an atypical immune response, which is why we discuss it here. These clients may experience flu-like symptoms or an upper respiratory infection, muscle pain or headache. They may have severe ongoing fatigue that worsens once again after physical activity, and it can be debilitating fatigue that actually interferes with their ability to work in or outside the home. These clients may also have frequent recurring sore throats, tender cervical or axillary lymph nodes, joint and muscle pain, headaches, and impaired short-term memory and concentration. We diagnose through medical history and physical examination, which should be unremarkable. The client may also have other physical or psychological conditions, but they are usually unrelated to the client's presenting symptoms. Blood tests are going to be related to chronic fatigue syndrome, which would include alkaline phosphatase, blood urea nitrogen or BUN, a serum calcium, glucose, thyroid stimulating hormone levels, and an exhaustive medical workup would include all diagnoses except the CFS. We're going to treat it by relieving symptoms, balancing rest with activity, providing supportive care, and potentially psychotherapy. The client diagnosed with chronic fatigue syndrome is at risk for injury related to neurally mediated hypotension. So to maintain the safety of the client, the nurse should do all of the following, except And that's encouraging the client to relax in a tub of tepid water for 15 minutes.